Welcome back. Today we're talking about knee surgeries and coming back from them. Often when people have had an injury, especially in the knee, even after rehab, their mindset about what they can do shifts. And comments I've heard in class or even in training is, I can't jump because I've had a knee injury, or I'm afraid I'm going to re-injure my knee. And usually after rehab, people are plopped right back into the gym environment where they started. So it's kind of hard knowing what to do. And today I have a really special guest expert who's going to talk us through just that. Dr. Andy Chen is the co-founder of Moment Physical Therapy and Performance, which is in New York City, where the mission is performance physical therapy to optimize your movement so you can get out of pain and avoid surgery. Welcome, Andy.
Thank you for having me on, Tina. And just want to say I really admire the message that you put out and how you carry yourself. I think you're just like, it's hard to not to smile, right? Just exuding energy. So thank you for having me on and just grateful to know you.
Thank you. Let's go straight into it. So from a PT point of view, what should we want or expect out of rehab? We'll just even specifically talk about knee surgeries.
Yeah, for sure. So I think from a general perspective, right, like what should we want out of rehab? I think what you should want out of rehab is getting back to your original goal. For us, it's not about like, I have to think smaller now, right? I had this injury. I'll never get back to running a marathon. I just want to be able to get back to running. It's like, no. For people that come into the clinic and people that walk through the door, if pain was not an issue, what's the thing that you want to get back to? Let's think about that, right? Like I can help you get back to these lower level activities, your day-to-day life, coming up and down the stairs without pain. But I want people to dream big. What's something that they've identified with? Like, hey, I have this knee surgery and I've never been able to do this. But if you have this knee surgery and I get you to do something that you've never been able to do before, that's what I want to go after, because now you're not going to identify with your injury because you haven't even been able to do this before your injury. So the wants that you should get out of rehab is, what's something that you'll do where you'll realize that the injury is a thing of the past now? What's a goal that we can start to work towards? And expect out of rehab, I think it doesn't seem like complex, right? But I think people should have complete transparency. What's going on now? Why am I experiencing this? What are the things that we need to work on? How does this exercise or the program that I am address these deficits? And when should I expect to get back to training or doing the things that I want to do? Oftentimes people are just like, all right, well, you ran out of visits because of insurance, or it's been about 3 to 6 months, so let's try running again, or let's try this. It's like, no, there's no trying in rehab. I'm taking a very calculated approach. If you're trying to get back to running, can you do your calf raises? Can you do your single leg pogos? Can you do your hopping patterns? Now, if you're trying to get back to running, that's just the calf itself. If I'm going to check off the quads, how strong is your quad, right? And we can measure this by anchoring you to something that's going to test your force. I can also look at how well you do your step downs, how well you load your split squats. There's so many ways to assess somebody's function. And if they're missing function, I wouldn't expect them to be able to get back to doing what they love. So what should they expect out of rehab? Transparency, a plan that's customized to them, that scales over time to eventually meet the demands of their goals.
That makes me think about, I don't think all rehab is that way. And that's your industry. You would agree that not everyone's experience is going to be just that?
I would say 90% of your experiences will be so far from that. 90% of your experiences will be you walking into physical therapy. Someone gives you heat, ice, stretching, some stim, maybe an ultrasound, a few exercises, you get passed off to somebody else. There's 4 to 6 people that somebody is seeing within the hour. So you don't get that one-on-one kind of attention. You're just a cog in this factory. And that's what 90% of physical therapy is, unfortunately. But I think that's 90% of every industry, right? Like 90% of restaurants shouldn't be open. They're terrible. 5% of restaurants do enough. They kind of meet your craving. 4% of restaurants are exceptional. You can't wait to tell your friends about it. And then 1% of restaurants, they completely transform what you think is capable of a restaurant. Right? It's like, wow, I didn't even know restaurants can do this. I didn't even know they can provide this kind of experience. And our goal is like, if we're going to start a physical therapy practice, I want to be in the top 5%. I want to be exceptional enough that you're going to recommend us to somebody else, or I want to be in the top 1% where I completely change your perspective of what's possible with physical therapy.
So with someone coming out of a knee surgery or knee injury that is very serious about, even though they might not be an athlete, but they're serious about wanting to go back to play soccer, going back to running, they're probably better off, it sounds like, going to a place where the physical therapist is also taking the plan very seriously.
Yeah, there's people that come in and I know I can help them, right? When I talk to some people on the phone, before anyone can come in, you'll probably speak with my wife, and she kind of screens you to make sure that the expectations are there. We get an idea of what you tried in the past, why it hasn't worked, what your frustrations are, and just making sure that the model that we have and what we can offer lines up with what you're looking for. But when someone comes in like with a knee surgery or a knee injury, it's like, what are we going to do? When someone comes in and they want to play soccer again, what does soccer require? Well, soccer requires deceleration, not just front and back, but also side to side, right? So if I am going to get someone back to playing soccer after the knee surgery, first thing we'll do, stand up. Can you shift weight to your side that's affected? Oh, you can shift weight to the side that's affected. Perfect. Can we start to do a lateral squat? Not a lunge where we get into the position, but you're keeping your legs stationary and then you're squatting towards one side. A lateral lunge, you start on two legs next to each other, and then you move into that position, which is more dynamic. From there, if you can do a lateral lunge, we can start to do a lateral bound where we'll jump from one leg to the other. And then now you're tolerating more forces. And then we go from like a Hayden, which is jumping from one leg and back to the other side. Then we can jump from one leg to the same leg. But I have all of these progressions mapped out in my head, so I know exactly what your body can tolerate. And until you can get through all of those progressions, I'm not comfortable with you playing soccer. But that's just from a lateral perspective, right? Mm-hmm. You also be able to move front and back. So what does that look like? Well, first, if we're doing locomotor patterns, you need to be able to march. If you can march, can you start to skip? If you skip, can you start to do switches in the air, which are more aggressive exchanges? And then from there, can you start to run? That's another pattern. And for us, there could be anywhere from 4 patterns that someone needs to work on to 10 patterns that you need to work on. But our process is so well thought out that I just need to get you to the most regressed version of that pattern. And I know that over time, I can progress you to the higher impact stuff because the body adapts. It just needs the right input.
And that's interesting. I was going to ask you a question about pogos and jump type activities because no one normally would think of it as part of rehab. And these are also activities you're talking about that a lot of times when people get older, they're much more apprehensive doing. Can you share a little bit more about why jumping, skipping, all that kind of stuff is part of knee rehab?
Yeah, I think we have to think about what someone wants to be able to do, right? So if you're playing soccer, since we're using soccer is impact. And the only way to put impact on a body is by jumping and doing plyometrics. Because when you do jumps and plyometrics, you can put anywhere from 3 to 8 times your body weight on one leg. And if you're a long jumper and you're a very specialized jumper, you could be putting 15 times your body weight on one leg. But for most recreational athletes, you're going to be putting 3 to 8 times your weight on one leg. Can you possibly load that up with a squat? It's going to be hard. It's going to be really
super heavy.
Yeah. And also these muscle contractions happens in split seconds, right? Plyometrics happen under 0.25 milliseconds. So it's like, those are things that you're not going to be able to be exposed to from a more general traditional strength training perspective. We need to do this kind of specialized training to start to recreate those fast actions that you're going to see in sport. And from a just general health perspective, plyometrics and jumping, those are the things that are going to put load into the bones. And it's not that load is bad. It's just, can you tolerate this load? If you can tolerate the load, you're going to get an adaptation. You're going to get benefits from it. If it's too much load, you're going to get injury. If it's too little load, your bones will get weaker. And that's what people get exposed to. They opt to avoid high impact activities to do too low impact activities to the point that their bones get weaker. Except they should be looking for the right amount of impact activities so that they can build adaptations over time.
Would that be with your PT, or would somebody know how to do that? Let's say leaving rehab and trying to figure out what's too much or too little. I think that's the fear when you're coming up, when you're done with your rehab.
Yeah, I think it doesn't matter what the title is. And I'm a firm believer that, trainers are part of the healthcare provider. Like to me, like personal training is proactive healthcare. Right now, when people are getting injured and they're in pain, that's when they start to see a physician, they start to see a surgeon or a physical therapist. I'm in pain, get me out of pain. But if you start to work with a personal trainer, now that's more proactive, right? If you're consistently strength training and maintaining your fitness or building it, you're going to reduce a lot of risk of injuries. And you're also going to reduce the risk of disease, chronic disease, metabolic disease. So it doesn't matter what the title is. It's just, is this person qualified? And then a degree or certification isn't going to qualify you. It's your knowledge and your experience. I know a lot of physical therapists that don't understand how to dose plyometrics or jump training. And I
Yeah.
know a lot of trainers as well that don't know how to do that. Now, with that said, when we go back to like 90% of people don't belong in the field, I think 90% of people should find something that they're interested in, right? Like if you're not actively thinking about how do I improve my skill set? How do I get better for my clients or the people that walk through the door? Switch professions, because that's what's going to separate you from everyone else. The top 5% will always be busy because they understand how to rehab people. They understand how to train people. They understand how to progress these impact activities, and they can actually deliver an outcome. So it really depends. It's not so much the profession, but what is this person's experience? Who have they learned from? Have they been able to do this before?
Mm-hmm.
There's trainers that I trust way more than physical therapists. And then there's physical therapists that I would trust to train clients more than actual trainers. It just really depends on what your experience is. And
Mm-hmm.
I have no skin in the game or horses in a race. The only thing I care about is the person that comes through the door. Can you help them? And if not, you should refer them to someone else that can.
Mm-hmm. I wanted to talk about also, or ask your thoughts on the psychology of coming out of knee surgery or an injury. I think I had posted on my Instagram, even a trainer she's been doing it for 30 years, recently had ACL surgery. She goes, I've dealt with it with clients, and now in myself, I can catch myself being apprehensive, squatting and lunging. So from a PT perspective, how do you guide people on that apprehension, even when they're coming out, even when they know what they should be doing or whatever in the gym?
I think a big part of like these kind of things that we have to battle or work through is normalizing it, right? Like it's normal for you to not trust your leg because you just had a really complex surgery on it and you haven't been able to train it efficiently. You've been offloading it. So your body's trying to protect this area. So naturally, it wouldn't make sense for you to be able to do these things efficiently, like squat and lunge, because you have to build these experiences so that you can trust it again. When it comes to like marketing, they say one bad experience doesn't get counteracted until you have 8 positive experiences. I don't know what that's like with rehab, but when someone's coming back from an injury, my goal is to provide a positive experience with the things that they're trying to do. So if it's trying to squat, I'm going to find some sort of variation of squat that they can do. So, they can do it with me, train it on their own, and eventually get to the point where like, oh, I've had enough experiences or training sessions, positive training sessions where I'm squatting. I can start to trust my knee again. Now I can't trust it to jump because I haven't jumped. So why would I trust it to jump? But I know I can trust it to squat. And that's what we do is we try to figure out what is a safe starting point for this person in front of me. How can I start to stack these positive wins? Because when you have these experiences, these positive training sessions, that's when you start to think to yourself, or your body starts to register like, I'm capable of doing this and I do trust my leg.
Mm-hmm. It's so interesting how the psychology of it is so relevant to recovery. What are 3 things people, I just picked a random number 3, should be doing, not avoiding, after finishing their knee rehab?
So I think there should be clear, we call it KPIs, key performance indicators. When someone comes in and they've had a meniscus surgery, ACL surgery, the most important thing is going to be the quad strength. And it's very easy to fall into a pattern where you're starting to take a more hip dominant strategy, right? Maybe you're doing a split squat and instead of keeping a positive shin angle where your knees are over your toes, it's your knees are right above your ankle and you start to hinge more from your torso to start to use your hips more. So that's just things to be mindful of. Am I using strategies and patterns that stress the injured or operated on tissue
Mm-hmm.
so that I can build strength over time? Or do I finish rehab and I resort to old patterns again, where I'm loading the surrounding areas and now the knee isn't getting the love or the stress that it needs, right? Like
Uh-huh.
it needs stress, and
Uh-huh.
we need to build it up over time. And that's what you should be getting out of physical therapy. Like, how do I know I'm in a right position? How do I know that I'm training efficiently? If you have a knee surgery, you should be building your quads, and you should also be building the whole kinetic chain, because if you have a surgery and you've put in a boot or a brace, chances are you're not using the joints above and below. So also strengthen your glutes, also strengthen your calves, the foot. I like to look at the opposite limb, right? There's looking to see what you can do on the opposite limb, and there's also looking to see what does the research say. There's certain normative values that I'm after. Everyone should be able to do 30 single leg calf raises. If you jump on one leg, you're playing maybe collegiate volleyball, I can find what the normative value is for vertical jump height for a collegiate volleyball player. But this is what I mean, where you have to do your due diligence. If I meet someone and I haven't worked with this person before, I'm going to look up as much research as I can to find out what should this person be able to do before I clear them to do what they want to do.
Okay, that's helpful to know. Yeah, to have certain KPIs. I guess we should always have KPIs in life, but and especially post-injury. Is there anything else, I guess, that you wanted to share that we should know coming out of a bad knee injury or knee surgery?
Yeah, I think there's, when we were kind of talking kind of before the call, it's like, oh, wow, it doesn't seem like this is physical therapy, or this style of physical therapy is very common, right? And I think you have to zoom out and think about like all of the potential possibilities or all the potential ways that you can help someone improve what's happening at the knee. And sometimes it's the knee itself, sometimes it's the surrounding areas. Most of the time, what I find is it's both, right? Usually people say things like these blanket statements like, oh, a knee issue is never a knee issue. It's a hip or ankle issue. And sometimes people say a knee issue is always a knee issue. It's not a hip or ankle. You got to focus on the knee. And in my head, I'm like, why not look at everything and just figure out what's actually an issue besides saying these things that might sound like great Instagram quotes or Twitter quotes?
Mm-hmm.
Like, you should do your due diligence. How do I know it's not an ankle issue? How do I know it's not a quad issue or a hip issue? You have to test it. So when you're looking at like someone coming out of surgery, you might go to a clinic and say, oh, you have knee pain or you're coming out of knee surgery. These are my favorite knee exercises. And like, that's cool. And it might help some people because they need it. But I can list like a bunch of things that I would be assessing, right? Like, how well does the shin rotate? Because you need the shin to internally rotate for the knee to flex. You need the shin to externally rotate for the knee to kick out. Does the quads lengthen? Because the quads need to lengthen in order for your knee to close. Can you use your hamstrings really well and pull it into active flexion so that the knee can close? Can you train your calves in a lengthened position, because that's what's going to help control knee bending? Can you do these kind of pre-impact activities, then do progressive impact activities?
I was trying to hold my cough in.
What does it look like for you when you squat? What does it look like when you lunge? What does it look like when you jump forward and back, side to side? What does it look like when you jump off the ground really quickly? How does your foot and ankle work? How does your hip work? What is your sleep like? What is your diet like? There's so many things that you can look at. And I think oftentimes people get a cookie cutter approach and they
Yeah.
think to themselves like, oh man, my knee's busted. I'll never be able to get back to what I love. When in reality, they never had a chance from the beginning.
I mean, I'm always sold on physical therapy. I always tell people when they have some sort of injury before they hit up a doctor to see a good physical therapist first. So everything you're saying just further emphasizes that.
Yeah, and I think the key is what you said, right? Like a good physical therapist.
Yeah.
There's a lot of patients of mine now. They'll call me when they're on vacation. Something happens to them, and I'm like, okay, I can't help you, but I'm going to connect you with a really good physician or a really good surgeon because I think you need to get this examined. And I've ended up becoming like a primary care provider for some of my previous patients because they want to run things through me before anything else. And, there's clear things where when you hear someone's story of what happened to them, like, oh, you got to see this person immediately. Or like, oh, you should be going to ER or you should be going to urgent care right now to get this checked out. But that's what happens when you, I guess, understand the research, but not a lot of people read the research. I think a lot of people enter a profession and they don't continuously get better. They just repeat the same year, 30 years and pretend that they had a career, and it's just doing the same old thing.
That is so true. They even see that. I mean, I know you don't talk about menopause, but like when I think about it, there's a lot of doctors or gynecologists who are not versed in what's current research. All they know is what they left med school with 20 years ago. So yeah, that's absolutely true. Yeah. Dr. Chen, and do your parents insist on calling you Dr. Chen? Because I know my parents, my sister's a PhD, so they're always like, that's Dr. Tang.
No, my mom doesn't call me anything different. I just have like, they just call me Andy. They say it with like a very Chinese accent or sometimes a Chinese name. And that's pretty much it. But
I love it.
For most people, I just say, just call me Andy. It's, some people call me, Dr. Andy, but it's, for me, it's just weird. I get that, but I just like to normalize myself. Like before I'm a healthcare provider, before I'm anything else, I'm just a human being. And I want that other person to feel that same thing.
Well, it's very evident in all your content too. Thank you so much for your time. If you want to find out more about Moment Physical Therapy or Dr. Andy Chen, I'm going to put all the details in the show notes. Thanks again, and I'll see you guys next week.
Awesome. Appreciate you, Tina.
I'm Coach Tina. For more information about how to work with me, head to ironstrongfitness.com and send me a message. I'll see you next time.